Welcome to the wonderful world of wellness with Dr. Andy Mencia. This medical program heard from 7 to 7:30 each Saturday right here on WSBR 740 AM is brought to you by the Adult and Geriatric Center under the medical direction of geriatrician Dr. Andy Mencia.
Well, good morning.
Good morning, Dr. Mencia. I'm freezing.
Good morning, Anita.
I'm cold. Why is it? That's a good question. Why do I suffer from the cold more than some people?
When it comes to temperature adjustment, the most important part is what we call the core temperature, the center. Exactly. We want to remind people it's going to get colder tomorrow. Please wear multiple layers when you go to bed. Start looking for that blanket just to have it in your bed. If you don't use it, you can always, if you don't need it, you can always put it aside, but keep it close to you so you don't have to get up at night and look for it. But when you go out, put multiple layers. And exactly. Like, I put my sleeve undershirt today just to warm myself up, and my shirt and, my jacket and my tie. So,
and your neck, you see, you wear a tie, so your neck is warm and covered
warm
too.
And covered, exactly. So, for those of you that like to wear a hat, make sure you wear something to cover your head. And the thing is, we can get sick so easily because we are used to the warm weather. And when you first go outside, because your core temperature is still so warm because of the environment that we have been living in Florida, you go outside, you don't feel it at the beginning. And then you go driving or you keep going, and then eventually it's going to hit you. Drink water, with the cold weather, make sure you drink plenty of water. Keep yourself
warm water.
Warm water.
You know what? I heat my water up in the microwave like coffee, but I don't put coffee in it.
Yeah, I remember when I went to Malaysia, I remember that with breakfast they would give us warm water, and we were up in a big. The hotel is up in a mountain, and they would give us warm water for breakfast. And the first time I just grabbed the water like cold water. I just grabbed the wine glass that they put the water in, and grab it, and wow, it's warm. Like, what's going on here? So they say, no, we serve warm water to warm you up before you go out. Because,
that's a very good point for people. Most people will get coffee and all, but I think warm water is a very good thing to drink.
It's a good thing. And, before we were talking about constipation, all of that, warm help the digestive system move faster. So if you drink warm water, I will have the honor of being a guest for the Hadassah group. Thanks to Mr. and Mrs. Klein, who invited me to go and speak there about the downward spiral of prescription drugs. And we were talking about if you take prunes for your bowel movement. And we brought Bill.
Good. You're full of shit. I guess I can say that word on the air. Full of shit. Well, yeah. And he's been better ever since. I mean, you're with us every time we walk, every time he thinks he's going to have he calls it a prune explosion.
A prune explosion. And, if you recall, Bill's problem was not complaining of his bowel movement, but his breathing. Remember,
yes.
It was his shortness of breath.
Right.
And you brought him to me, and I look at him, and I say, we need to get you to move your bowel.
Right. It took you 1 minute, and where he had to go, he went and had a chest x-ray and all that, and you did 1 minute and said, Bill.
We are full of. We got to empty you up.
That's right, and that's made a difference. I think, though, he, I'm thinking about that.
A lot of people, they do prunes. Yeah. But they do it right off the refrigerator.
Yes. Yes.
So.
Well, I remember my grandfather had prunes every single morning, but they were not, Bill takes it fresh prunes right out of the package. Mm-hmm. And I've told him I'll get him stewed prunes. Mm-hmm. But he said, no, he can eat it this way. But my grandfather had stewed prunes every morning.
And was it warm or?
No, I don't know what it was.
Because I remember my parents in Hawaii, they used to take it the night before and just let it settle, and they will cover this. And, you know, we would sneak around to see like what they covering here. We taste it. We hated it. And they would leave it outside, and then in the morning they would come and drink it. And I would ask my mother, why you do that? Yeah, because warm, room temperature, it works better than when it's cold. Cold is to just preserve it. But when you're going to drink it, you want to drink it warm.
Then maybe then, Bill, taking the prunes out of the refrigerator isn't as good or effective as if we took the prunes and they're not going to go bad in a day.
They're not going to get bad in a day. You just put it outside, cover it up so you don't get cockroaches and what have you. Just cover it up. And then, or a little plastic container that has a lid on it, and leave it outside from the day before. And
definitely.
So if he does 6 prunes, just tell him take 6
Bill.
out.
Dr. Mencia was on the show, and we're still giving you the prune deal. So here's some new news for it.
We're changing the strategy to make it more explosive.
Right. But go ahead and go back to your speech. I'm sure they loved you. The Hadassah is a very powerful world group. It's not just local. This is worldwide.
They're a world organization. They support Israel a lot and many other organizations.
Hospitals, they're very, very good.
They are very involved, and they are very involved with their community in their different chapters. And to me, it was an honor to be invited to speak at one of their meetings. And we were talking about the downward spiral of prescription drug, and the question was excellent question they brought up.
Like what?
They were asking about vitamins, what's the best way of taking vitamin? Do I really need to take a lot of vitamin? Is that necessary? And with the first one, no, of course, you don't want to take all your vitamins at one shot. You want to sort of spread them out throughout the day, because vitamins are chemical. They are more natural, but they're still chemical. Every vitamin that you look at, if you look at them, vitamin B12 is cyanocobalamin. Every vitamin is a chemical name to it. It's not just, it's not a piece of orange or a piece of raspberry. It's a chemical. The anti-inflammatory has papain in it, but that comes from the papaya. But you are not eating a papaya, you're eating the chemical when you take a vitamin. So what I was telling, because they are chemical, they will compete with each other in the gut for absorption. Because when you absorb chemical, they go through these little windows that recognize different chemicals. So chemicals that are very similar, like let's say vitamin C and vitamin E, they are very similar to each other. They compete for the same door to enter. So if you take a bunch of vitamins C and E at the same time, they are going to block each other. Some of them, whoever is the weakest one, is going to end up in the toilet bowl, which is a waste of your money. So as we take vitamins, we need to sort of, especially if you take multiple medication, multiple vitamins, all natural stuff. But if you take several of them, because they are all natural, it doesn't mean you have to take a handful and swallow them. Spread them out throughout the day. That was one of the advice. And by doing that, you are absorbing more. Now, one of the questions that came, do I really have to take all these vitamins? Is that really necessary? And one of the beautiful, beautiful lady that came to see me, she's 80-something, but I swear to you, Anita, this lady looked like 50. Beautiful skin and well taken care of. And she, she said, doctor, I don't take any vitamin. Is that okay? I said, well, looking at you, I think you have a good life. You take good. She said, oh, absolutely. I watch my diet. I don't eat bad food. I never eat junk food. I don't drink Coke. I don't do anything that is not good for my body. I never done it. I grew up like that with my parents, and I had kept that way. My husband was like that. And I kept that way up to today. I said, well, you have the genes and you're taking care of yourself. So in a case like yours, no. And I told the audience, I told them, I said, look, I sell vitamins and products at my office. But if you listen to us on the radio show, I'm always advising people that the best way to obtain the best source of vitamin is Mother Nature.
So I should be getting a papaya rather than...
You're being, exactly. Whatever you can do with your diet, if you take a salad that is very colorful with yellow and green and red, a very colorful salad, you're getting so many nutrients right then and there that we don't need to go and take a multivitamin if we have a good diet. And then what I was explaining to the audience is the reason I have some product and not like, a supermarket or product, just some product, is because when I do my blood test, if I see that the folic acid is low, then I can tell my patient, okay, get some of that folic acid. I have done the research because one of the persons say, I go to the store and I look at,
there's shelves and shelves of
vitamin D.
vitamins.
My God, there's so many vitamin D. How do I know which one I'm going to take? So what we have done at the center is we have two dietitians, excellent dietitians.
Yes.
You met both of them.
Oh, I love both.
And they do the research for me and with me, and we come and narrow it down. Which, if I'm buying this out of packet, if I'm putting my money down to buy this product, which one is going to be the cheapest, but the best quality? Because some of them, you might have 4 vitamins that are great quality. And 2 of them are super expensive. And one of them is half of that price. And the other one is a quarter of that price. So you have, if I'm going to choose from those 4, I would choose the cheapest one because it have basically the same quality as the others. The other might have more advertisement. So people buy more and they are making more money. But this company is producing the same quality, just a little bit cheaper because, I've
been on your D. Bill and I both take what you have recommended.
The vitamin
yes,
D. We spoke about the vitamin D.
Yes.
And that it was great, that question. We say, why should I take vitamin D if I live in Florida, I get exposed to the sun? And the answer to them and to everybody is that vitamin D stay on your skin. So when you get the radiation from the sun, it get activated. It goes through the first step of activation, and then it goes into the kidney, and the kidney will do the second step of activation. But it's like if the skin and the sun is the motor of a car, the vitamin D inside you is the gas of the gas, the tank we gas in the car. So if the tank is empty, you can try to turn the engine on all you want to. It's not going to go anywhere. We have to put some gas in the car. So I usually check the vitamin D level. And if the vitamin D level is low, you have to take high-powered vitamin D to fill up the tank. And then you can get exposed to the sun, and then you can activate the vitamin D. So what I recommend to my patient at the office, we get the 5,000 unit vitamin D to take 1 a day. And when the level goes up to 60, around 60, then I tell them, okay, you can stop that one now and just go to a maintenance of vitamin D, 500, 600 international unit of vitamin D to maintain yourself. But vitamin D is like B12. When the B12 level go down, we have to increase and do shots every month or every week to bring the level up. And then when the level is high, then we can do every 3 months. So we have to monitor the level. It's not just getting the level and one day you go for one of those screening tests and it's hit or miss. You go and you have eaten well for 2 months prior to the screening test and they say, oh wow, your vitamins level, they are all great, you're doing good. And then you live with that number for the rest of your life. It doesn't work like that. You have to keep checking every so often.
Okay, wait, I have a very important question. I've been listening to the news and Hillary Clinton says that she's eating hot peppers. And she learned about this years ago. And she said that she's not sick and that she has great energy from this hot peppers. Now, I know that hot peppers have capsaicin in it.
Right, exactly.
But have you heard that hot peppers are good for your health?
Yeah, because you get capsaicin right from the product. From the best source of capsaicin is hot pepper.
And it
I
can't
love
be
hot pepper.
You do?
Yes.
And
all you need to do is like, you can take some hot pepper and just slice it and put a little bit on your salad. That's what I do. I put it on my salad. I can put it around my meat. So when I cut my meat, I take a little bit of hot pepper so it's not
too hot,
me.
right?
Exactly. So
because I don't want to get burned, but I'd like to start doing that. You recommend this?
Absolutely. And make sure to take care of your hemorrhoid first if you never had it.
No, I haven't had that. Is that because that would affect that?
Well, yeah. Well, hot pepper is an irritant for the guts also. So the caseation is what we want from Mother Nature. Take it from hot pepper. But some people just take too much from the get-go. Your body have to get used to it. Once your body is used to it, then you just keep doing it.
So I'll do that. So what I would do then is I can take one and it looks like a green pepper, a little green pepper, but I did a hot one. And then I just cut it up tiny little pieces. You slice
it in tiny little slices.
Yeah.
And then you get your body used. Just take a few and put it like when you're going to have your meat, you grab one of those hot pepper with a piece of meat and you chew it.
And you can see that when she says she's not sick and she attributes it to...
Oh, absolutely.
Really?
Yes, many, Indian culture and, I remember when I went to North Korea, they will serve a lot of hot pepper. They believe, they cannot afford. That's one of the things I love about traveling. They cannot afford the waste of prescription medication that we push into our own society. The pharmaceutical company, they become billionaire. Not by selling this drug to Mexico or China or India. They sell it to American. So we buy, and in the process, we are killing each other with too many medication, too many prescription. And whenever it comes to in healthcare, to holistic approach, they don't even want to look that way. Everybody's going to lobby against eating hot pepper. We hear from Hillary Clinton and other celebrity, and then we pay attention. Nobody want to hear about my book on prevention of kidney disease because it's a huge market on dialysis. So if we prevent half of the people that are ending up in dialysis, that would be billions of dollars that we are stopping from being, going to big organizations that can lobby for better dialysis equipment, more funding, do this for us. We should go to the root of the problem. How do we prevent this,
And we're going to come back. I just want to tell everybody about Dr. Andy Mencia, who's, of course, the main show of this time. But while I'm doing this, Dr. Mencia, think of some other foods maybe that we ought to recommend to people, just like we just did. But I'm sure you know so many. Okay, this is Dr. Andy Mencia. He's the founder of AGI Medical and Dental Centers. He is a geriatric physician, which there are very few, and something I don't say enough of, he is a great diagnostician. So if you are being moved around from doctor to doctor and you're still not getting satisfaction of what's wrong, go and make an appointment to speak to Dr. Mencia. He's very smart, and he really understands so many things about people's medical problems, even mental problems. And so I'm going to give you a phone number to call him in Fort Lauderdale. It's 954-489-1345. And they have a wonderful, beautiful office in Boynton Beach. It's 561-270-6494. Now, I know that Fort Lauderdale is open with all the processes on Saturdays.
And
Boynton Beach also.
Yes.
So both offices. So one of the two convenient South Florida locations are open Saturdays, which is rare. It's wonderful. And for those of you, especially now in the cold weather, if you're a homebound person, you can't get out of bed and you haven't been able to have a doctor visit you, this is your lucky day. Call the numbers that I just gave you or go online, AGIFL, that's AGIFL.com, and make sure that you get someone to come to visit you. Okay.
I had a flight attendant that came to see me this week. And she developed a horrible cold and was very concerned, and she's flying next week. And she was so happy when I finished. I gave her the prescription. This is what you're going to take. This is the type of tea I would recommend, and prescription medication. This is what I would recommend. And she said, if I don't want to take the antibiotic, would you be upset? Would you be okay if I said, no, I would be okay. I just want you to I want to make sure that you are able to fly. I don't want you to fly if you're sick. So I want to make sure that you are able to fly. And I told her, well, Saturday, tomorrow I'm open. She was excited. Oh my God, you open on Saturday? I said, yeah, I'm open tomorrow. So if you need me, come back. If you want me to check you one more time, it's covered by your insurance. And just young flight attendant, beautiful lady. And, she came in with her partner. We are sitting, talking. And I told her, you know what I'll do for you? Because you are flying next week, I will keep an open door for you. You don't have to call for an appointment. Just come in if you want to be checked. Because I really don't want you to fly if you're still sick. And she was so excited. So she made an appointment. She said, I think she's flying on Thursday. She's going to come back on Wednesday to see if I clear her for takeoff. So
for takeoff, right?
Can you clear me for takeoff by Wednesday? I said, sure, come in. And she was so excited that we are able to cater to, not only the elderly, but also, the young adults. That's why AGI, the Adult and Geriatric Institute. Yes. We cater to both, and we care to both the same way, with the same dignity and the same respect. And I tell my staff, if you could treat my patients as if we were a 5-star hotel, and then let them become patient when they are in the room with me. But the moment they are on the process to walk in and to walk out, those are your guests in a 5-star hotel.
That's
Treat
beautiful.
them like such.
That's beautiful.
And the dental department and everybody have embraced this concept.
Okay, so I'm giving you a chance. Give me a couple of foods that the sun's coming out. It's looking good.
Yeah, looking good.
Okay, so we talked about papaya. We really didn't.
Papaya is very important. I remember in Hawaii, if you develop a rash, we would take the skin of the papaya and just put it on top of the rash.
The outside skin?
Just the outside skin. You just peel the outside skin, and then you put the inside part on the rash, and you leave it on for about 10 minutes, then you take it off, but you don't wash it off. You just let whatever product is there, leave it there. And you keep doing this throughout the day, and most rashes, even patients with shingle will take papaya and will treat themselves this way. Of course, we need the antiviral medication for shingle, but go and try to buy the acyclovir ointment. It's so expensive. It's extremely expensive. The acyclovir, the pills, they are cheap. They are very cheap. But the ointment, for those people that have like HMO or some bad insurance that won't cover prescription very well, they usually won't buy the ointment. So if you cannot afford to buy the ointment, that's a good alternative. Take the papaya, eat papaya. If you have colitis or any inflammatory process of the gut, GERD, you have reflux in the esophagus, eat the papaya, cut the papaya in pieces, and you go around eating the papaya until you feel better. And it's medicinal. So papaya is great. We talk about supplement, a multi-billion-dollar market. When you eat your salad, make it colorful. Go schizophrenic. That's what I tell my patients.
Schizophrenic salad. I love that.
Yeah, you know how a schizophrenic patient, when they are out of control, they start coloring all this colorful picture and stuff. And I say, go schizophrenic, go green, red, purple, everything you can come up. And when you make your salad very schizophrenic, very colorful, you are eating the best salad ever.
I am now going to serve my guests. When you come to our house, you're going to get a schizophrenic salad.
We should make
my gosh, I love that.
High five to that.
We
should make a recipe. It should be our recipe.
You know what? that's
Anita
gonna,
and
listen,
Andy schizophrenic salad.
Yes, February issue, heart, it's love.
Yes.
Love your salad, schizophrenic salad. I'd like to do that.
Yeah.
And you and I
it.
should talk. I have an idea what it should be in there, but I'm, the kale and the peppers, and now we're going to do a little hot pepper.
Yes.
Right?
Yes, a
In
little
that
hot
salad,
pepper in
right?
there.
We'll
talk to,
can we put a little fruit in there too? Nuts?
Nuts, yes. Fruit nuts are really good. They're healthy they are very healthy. With nuts, remember that you have to have good denture. You want to bite them properly. If you have diverticulosis, be careful with nuts because it can exacerbate your diverticulosis. And that's one thing that I love about being an MD and be able to talk to my patient about homeopathic medicine. Because when we go to a technician that and they know a lot of them know more than me. But what I do, I look at the medical condition of the patient. You mentioned about fruits. I have one of my patients that went to a talk and they were talking about eating a lot of salad and a lot of fruits. So he followed the instruction. It sounded really good. You're going to lose weight. You're going to feel good. You're going to feel energy. So he went and he bought one of the bullets and started juicing with vegetable and fruits. And we'll do one juice with vegetable, one juicing with fruit. His sugar started skyrocketing. And I kept asking, what have you done with your diet? I'm losing weight. I'm so happy I'm doing this. No, something is wrong. If you are losing weight, your sugar should be coming down. We should be taking you off medication. We are increasing your sugar medication. It's not right. What is it that you are doing? So he said, I went to this talk and he explained to me. I said, okay, this is your problem. The vegetable, yes, they are for you. The fruits are not for you. That's for somebody else that is non-diabetic. Because, like I usually tell my patient, I say, you have two types of sugar. You have the sugar that men process. So it's those processed sugar that we buy. And then you have the sugar that God processes. And the one God processes, he gave it to us through the fruits. So if you are a diabetic, both of them are bad for you. So stay away from them.
Okay, so we have to say goodbye, but I have a schizophrenic salad. It's going to be on our,
me too. I'm gonna have
on
one.
February the heart. Yeah, it's wonderful. Schizophrenic breakfast, schizophrenic. I'm all for that.
Yeah.
Yes. Dr. Mencia, thank you. I want to give everyone
Anita,
your phone number again. 954-489-1345 in Fort Lauderdale and 561-270-6494.
If you have kidney problem, drink coconut water.
We're going to do more of this. You and I'll talk about it, and I'll add it into the article. Thank you so much, and
thank you, Anita.
Wonderful. It's always a pleasure to have you here.
Thank you, Anita.
Okay, we'll be right back. Just stay with us.
With my friend.
Thanks for listening to The Wonderful World of Wellness with Dr. Andy Mencia. Be sure to tune in each Saturday morning from 7 to 7:30 right here on WSBR 740 AM.